The colostomy surgical procedure is what we'll be looking at next. Colostomy, right? So you get to see that colostomy just have to do it. Yeah, it could be that, yeah. And the person has some one or two obstructions up. So as they have some one or two obstructions, or probably an anal cancer or so, now they actually had to put an artificial bag. Okay, so the bag will be collecting the stools, right? The bags will be collecting the stools, right? For the on behalf, like the stools will not be coming through the anus again. Probably they did a surgery that they resected the anus, or there's anal cancers, right? And all that. So they might actually will just want to just put a bag out. All right. So we'll talk about this surgical procedure. We'll talk about the types, talk about the indications, why you are doing a colostomy. Talk about the procedure, post-operative care, and possible complications that could result from a colostomy. Then lastly, we'll talk about the difference between colostomy and ileostomy. All right, because people kind of like confuse the two stuffs. So now I'm trying to move. We said that colostomy is a surgical procedure that creates an opening in the abdomen. And this opening is to divert stool from the colon. That's the large intestine. So you are trying to divert this stool to an external bag. That's what ostomy bag. Okay. So you can see this. You want to divert the stools into an external collection. Right. So what are the types? You go have the end colostomy, which is the most common type, where the colon is brought to the surface. You go have the loop colostomy, which is a temporal procedure, right? And this temporal procedure now coming. This temporal procedure is when the loop of the colon is brought to the surface, right? Then you have the double barrel colostomy, where you're having two separate openings. One is for mucus and one is for what? Stool, right? Then moving forward now, what are the indications? When will you actually need to do a colostomy? If the patient has a rectal cancer, so there's rectal cancer, there's so much pain, you don't want the stool to actually come to the rectum. Okay, so you divert it. If there's inflammatory bowel disease, if there's diverticulitis, if there's bowel obstruction, if there's trauma or injury to the rectum or anus, okay? So anything that will actually bring pain, you are trying to avoid it, okay? You're trying to even avoid it before time. All right. Now, what is the procedure? How is it done? Like, yes, before you do the surgery, you actually prepare the patient as a pre-operative preparation, okay? Bowel cleansing, you give antibiotics, prophylaxis, just to prevent any possible infections, right? Then you now incise the abdomen, you try to locate the colon, you resect the colon, you create a stoma, then you put the ostomy bag. From outside, you connect it, okay? Now, what is the post-operative care? Yes, there will be pain, so try to manage the pain. There will be a wound there, all right? So there's a wound there. Try to always address the wound to prevent any infections. Then ostomy bag management. Of course, if feces is collected there, you have to now empty it. Okay, feces is collected, you have to empty it. Then dietary adjustment. Of course, the person will not be eating as though their mode of passing out feces is normal. Okay, so they actually have to adjust. The emotional support, because imagine from passing out feces now, your feces is being collected in the bag. So, guy, you'll be overthinking and all that. All right. Then complications. This could lead to what? Infections, could lead to skin irritation, could lead to obstructions, could lead to stomach prolapse, could lead to what? Bowel leakage. All right. So that's it for colostomy surgical procedure.